Good day everyone, good day surgeon. In this video, we are going to demonstrate a certain projection of vertebral column. What is vertebral column? Vertebral column is a spine that forms the central axis of the skeleton and is centered in the mid-sagittal plane of the posterior of the trunk. So for further information, we can say that it encloses and protects the spinal cord, which acts as a support for the trunk, support for the skull superiorly, and provides attachment for the deep muscles of the back and ribs laterally. In this video, we are going to demonstrate a certain projection of the vertebral column. And the name of the position that I will be demonstrating is the Kasabach Method, or what we call the oblique odontoid projection. This method is performed when the odontoid cannot be visualized on an AP open mouth. In the cases of trauma or in patients with the decreased range of motion, their body must be rotated by 45 degrees. So this method also demonstrates the oblique view of the odontoid process. So what is the odontoid process, you might ask? So the odontoid process, or what we call dens, is a tooth-like projection from the second cervical vertebra on which the first vertebra pivots. It exhibits a slight constriction or neck where it joins the main body of the vertebra. So the odontoid process is located here on this part. So before I introduce you to my patient, in doing this procedure, the first thing to do is to remove any artifacts such as earrings, rings, and watches before we get to the procedure. So for my patient today will be my younger brother.
Hello.
So since I introduced my patient, we are going to position him. Patient must stand still and remain supine or upright. Okay, since we already covered what the patient should do and where to stand, the part position would be we have to adjust his or her body and head at a 45 angle degree. Okay, so our patient is already angled at 45 degrees. So after setting our patient at 45 degrees, we must center the image receptor to the second cervical vertebrae. So the second vertebrae is right here. So the central ray of this position is 15 degrees caudally. So what does 15 degrees caudally mean? So 15 degrees caudally between the outer canthus and external auditory meatus, entering midway. The SID is 40 inches, the collimation is 8 by 10 inches. And that is all. Thank you. So, since I introduced my patient, we are going to position him.
And most stupidity.